Digital Health Review is on a mission to help you discover, decide, and go digital in your healthcare. My name is Blair Hirst, and I've spent 10 years in health tech building software for patients and providers. And I've become acutely aware of the impact and breadth that technology can have in the healthcare system. But I'm also aware of the health inequity that already exists. In particular, 1 out of 4 Americans don't have access to a primary care provider. Now, this is for a host of reasons, but it mostly affects Black and Brown individuals, those who have low income, and those who live in healthcare deserts. Now, I have strong conviction that the use of digital health can actually improve health equity. Rock Health has discovered that 2 out of 3 digital health users adopt online health information tools to better understand their health options, effectively improving health literacy. And during the pandemic, a study was able to show that the rise in telemedicine usage effectively eliminated historic racial health gaps. With the increase of investment in these types of tools, the future of healthcare is pretty clear that it will be digital. But now the question becomes, how do we ensure that those who could benefit the most get access? Well, we first must understand their barriers to entry so we can help consumers sort through the noise. Right now, there isn't one place to compare products, and we're fighting a massive lack of trust in both healthcare and technology. And those who would use the tools are deeply concerned around clinical validation and data privacy. So the solution is Digital Health Review, a web platform of vetted digital health products where users can easily buy solutions and companies can seamlessly connect with the right user. Members on our platform will be able to search by category, review a selection of options, and become informed through our cost and reimbursement guidance, our data privacy reviews, our clinical validation reviews, so they can become empowered to purchase the right product to care for themselves or their loved ones. Now, our business model is quite simple. For the users on the platform, it will be free, but we will charge a monthly subscription fee to the listed companies or our customers on the platform. The question now here is there a great demand for digital health companies to reach consumers? The answer is yes. We know that more money is being spent to market health solutions to consumers. And last year, $11 billion was spent on ad spend in healthcare and pharma. We believe that $11 million is a comfortable market share for Digital Health Review to capture by 2025. There are other vetted libraries on the market, but between our branding, our go-to-market strategy, as well as our unique feature set, we know that we stand above the crowd. We'll grow market adoption on our marketplace in 3 main ways. The first is through content to help with brand development, events to help with demand development, and we'll partner with ecosystem vendors and academic institutions to help with supply development and ensure that the companies on our platform are building patient-centric tools. We vetted this go-to-market approach thoroughly by testing and asking our users to define their pain points, verifying our customer profiles and their demand for exposure, and developing community engagement, effectively 4xing our monthly active users in the last 3 months, gaining 500 subscribers to our newsletters, over 15 user signups, and participating in 3 thought leadership engagements. This activity has resulted in one of our prospects converting into our first paying customer, with several in the pipeline. Over the next 18 months, our goal is to reach 1,250 customers. But that's a long way to go. So how are we going to get there? Well, through financing. We're looking for 18 months of financing to reach these customers. We believe that an $800,000 investment for 50% equity in our company can reach the 1,250 customers and effectively bring in $2 million in revenue over the next 18 months. These funds will enable us to hire, product development, marketing support, and sales support. So if you believe in a world where digital health is used by all, and you want to discover, decide, and go digital in your healthcare, please sign up for free. And if you're an investor, digital health company, or community manager, please get in touch with us. Thank you.
Thank you so much, Blair. Really wonderful presentation here. Really great to learn more about digital health review. We're going to jump straight into the judge panel. For the first judge is Robin Moon.
Hi, Blair. I have a question for you. It's not clear to me, at least through this presentation, if there are criteria through which you select or you decide what kind of digital health customers you're going after. In other words, who's your beachhead market segment?
Absolutely. We're targeting D2C companies that have digital or physical or tech-enabled products or services. So these are companies that allow consumers like yourself or myself to go onto their website and purchase their products independent of a healthcare provider, effectively increasing the use of healthcare access, healthcare tools to consumers who may not have a provider.
So wellness, no diagnostics, like that kind of focus. That's what I'm looking for. Like who. Yeah.
Oh, absolutely. This is across a variety of categories. So this could be DTX, digital therapeutic companies. This could be diabetes companies. It could be wearables. It could be apps. It could be any tech-enabled product or service across a variety of therapy categories.
Okay. Thank you.
Thanks a lot, Robin. And next up, we have Terika McCall.
Hi, Blair. Thank you for that presentation. I just have a quick question. So my question is around, it looks like this website is going to be used specifically if I wanted to go and research certain digital health products that are out there. But this seems to me like maybe it might be a one-off if I'm looking for a mental health app. How are you proposing to make this more sticky? Is there going to be some personalization? Will the user get contacted based on like if they fill out something in their profile saying that these are their interests? So how do you continue to get that engagement beyond a one-time use thing?
Absolutely, and that's a great question, Terika. So there is opportunity here to grow the platform in our roadmap to create a more personalized experience. So if Terika were to go on and say, I have interest in diabetes care management. I also have a friend that's having a baby. I want to know what baby care tech is. I live with my elderly parents. I'm also interested in senior tech. I can curate an experience for you that brings up products that fit the needs that you've expressed. And as new things come to market, bring you back to compare those products as well. So yes, there's absolutely opportunity here to customize the experience for users and to create a more stickier experience.
Thank you, Blair.
Thanks a lot. Next up, we have Norbert.
Blair, thank you so much for all your work and the presentation. My question is around the clinical validation piece. I think that part is pretty important to justify your value prop for your customers, given the price point and just to drive engagement and continuity. And kind of how do you think about that in light of the fact that there's just kind of low level of clinical robustness and rigor in digital health as driven by either, or as rather as kind of measured by either clinical trials or filings. How do you think about kind of your solution maybe driving greater uptake there or just driving consumer engagement, given that the validation piece isn't as built out yet?
That's a great question, Norbert. I think we can all here agree that the more companies that have gone through evidence-based research, the better for everyone. And so through our go-to-market approach with partnering with ecosystem vendors and academic institutions, our goal is to help companies understand what that process is to become clinically validated or to get evidence-based research and help support them through that process, whether that's 510(k) applications, connecting with potential PIs to help them go through that research and development process, or connecting with other companies that have done that so they can learn about their process and potentially partner with them through that development process. But I agree, Norbert, this is a critical area of distinction for us and distinction in the market. And we're ideally hoping to just facilitate more and more companies becoming evidence-based companies.
Thank you.
Great presentation, Blair. So my question is really about when you looked at the marketing spend, how do you kind of market the ROI on this platform? Do you have a sense of those projections versus conventional marketing spend? Obviously, these are qualified leads, but it's also much more targeted and less broadly available to the public.
Sure. I just want to make sure I understand your question correctly, Erica.
Yeah.
You're asking how are we drilling into the marketing spend around D2C companies? Is that correct?
Yeah. So one of your slides suggested that medical and pharma spent $11 billion on marketing last year, and that obviously is a breadth of options. This is a very specific one that presumably has a higher conversion. But have you done some of the projections on the ROI versus other marketing spend that they could spend?
Yeah, absolutely. There is research and done around what percentage breakdown is going to, for example, pharma or biotech or medtech services. Are they provider facing or consumer facing? So there is that breakdown. I do know that there are marketing solutions that exist that are trying to help companies better understand their positioning in the market, as well as further customer segmentation. It's going to be imperative, and there's going to be a high ROI if companies can determine who are the right users for my platform, who are going to be stickier. Are we looking at a certain age demographic, a certain location? Are we looking at certain health conditions or progression in those health conditions? And so if we get there by first being on our platform, comparing who's going to their site, also giving them information about what's happening with comparable competitors in the market and who's hitting their sites and what the market trends and insights are, that means that companies becoming smarter and able to build tools for the right customer segment and getting a higher ROI by using our platform.
So that makes sense to me. I think the question is more specific to if I'm going to pay $99 a month, how many, what is my projected financial return? I think, have you done any of that?
Yes, yeah. So the average lead in healthcare spend sits around $250 or a little bit higher. So if we can convert for $99 a month, one lead, you can sort of do the math there and say the math adds up, that it's a lower cost to be on this platform and to gather in the lead. Leads in the healthcare space are quite high. And so if we can help that process, the ROI is about half of that or less than half of that.
Thank you.